Welcome back guys in this second part of this tutorial video about a peptic ulcer. In the first part of this video already we have discussed about different parts of a stomach, different linings of a stomach, process of digestion, hypersecretion, hyposecretion of HCl. Now in this second part of the video we'll talk about mechanism of HCl secretion from the parietal cell. Similarly we'll talk about causes of a peptic ulcer and treatment of a peptic ulcer. So let's move on towards our next slide. So guys, you can see this is the parietal cell. All the cells have a blood supply. So you can see this is a blood vessels which consist of oxygens and different chemicals and substances that is essential for cells. So you can see here carbon dioxide, bicarbonate, chlorine. I have shown only those substances which are important for this chapter. Definitely this is a parietal cells, means they should have a water. When there is blood supply to these parietal cells, this carbon dioxide will enters into the parietal cell and they will make a reactions. When water and carbon dioxide react together in presence of enzymes known as carbonic anhydrase, they will form a carbonic acids. So but these carbonic acids are very unstable. Whenever there is formation of a carbonic acid, immediately they will dissociate into a bicarbonate and a hydrogen ion. So you can see here the carbonic acid has been dissociated into the bicarbonate and hydrogen ions. And in parietal cell we'll find one pump. The name of this pump is known as a proton pump. Also we call as a hydrogen potassium ATPase pump. So these hydrogen ion that are formed by the reaction of carbon dioxide and water, so the all hydrogen ion they will come out from this pump. And similarly when there is blood circulations, this chlorine also come out. So this H ion and chlorine ion, they will react together and form a HCl. Similarly there are some other receptors present inside the parietal cells, like we have a H2 receptor. Similarly we have a acetylcholine receptor, and we have a gastrin receptor. And whenever we want to control the secretion of a HCl from the parietal cell, we will target to block this pump. Whenever this pump will get blocked, that time this hydrogen ion cannot come out from this pump. For example, we will give a pantoprazole, omeprazole, rabeprazole, lansoprazole, esomeprazole. So these are PPIs, and whenever we are giving this drug, they will go and bind or they will block this pump. When this pump is blocked, the hydrogen ion cannot come outside, and so there is no formation of HCl. This is how we can control the secretion of a HCl. Similarly, we can give a H2 receptor blocker also, like a ranitidine, famotidine, cimetidine. So these are H2 blocker drugs. Even we can reduce the secretion of HCl by blocking the H2 receptor. Even we have a ACE receptor or a gastrin receptor we have a, but since these are we will not go and block this kind of receptor, because we will find many side effects whenever acetylcholine receptor are blocked. Only the safest way to control the acid secretion is by blocking the H2 receptor and blocking the proton pump. So already we have told that whenever there is excess secretion of a gastric acid, it might cause the peptic ulcer. It may damage the lining of a stomach, right? So in this figure you can see this is a proton pump and this is H2 receptor. So what we'll do, we'll target two things. First is that we will give H2 receptor blockers. For example, we'll give a cimetidine, famotidine, nizatidine, ranitidine. So these are important H2 receptor blockers drugs that will blocks the H2 receptor and in the stomach, especially in parietal cell, and suppress the gastric acid secretion. This is how we can control the secretion of a HCl. Similarly, this is a proton pump and we can give a proton pump inhibitor, PPIs, we call as a PPIs. So example like a omeprazole, pantoprazole, lansoprazole, rabeprazole, they will block the hydrogen potassium ATPase proton pump and inhibit the secretion of a HCl. Next thing is by neutralizing the gastric acid, right? So if already in stomach there is excess amount of HCl, means we can give a antacid. Antacid means they will neutralize the stomach acid that is already present in the stomach. We can give a drug like a magnesium hydroxide gel, aluminum hydroxide gel. Also we can give a calcium carbonate. So these all things are to help in neutralizing the gastric acid. Similarly, we have a protecting stomach linings. For example, because of excess secretion of HCl, the layer of stomach might have damaged. So in that case, what we can give? We can give a anti-ulcer drug like a sucral fat, and this sucral fat will form a protective barrier over the ulcer and protects against the pepsin and gastric acid. Also, it will help in healing the ulcers. It will help in healing the erosions, help in healing the ulceration. So this is the important things. We can give a sucral fat for protecting the lining of a stomach. Similarly, we have a prostaglandin analog like a misoprostol. Usually nowadays this misoprostol is not used because this drug are contraindicated in pregnancy. A few years ago this misoprostol was used as a treating a peptic ulcer, but what we found that in women, especially in pregnant women, it caused the miscarriage of babies. So these are contraindicated in a pregnancy, and usually this is not in practice. Okay, so this was about treatment of peptic ulcer. So we have seen about the mechanism of HCl secretion from the Paral Cell, and treatment part we have completed. Now we will move on towards the next slide. So you can see on my screen there are different chemicals like a mucus, bicarbonate, blood flow, and prostaglandins. So these are very important chemicals that plays as a defense system of our stomach. They will fight against those chemicals, substances, corrosive agent which cause the peptic ulcer. So mucus, bicarbonate, and enough amount of blood flow, and finally the prostaglandins. These are defense system that protects from the peptic ulcer disease. For example, the mucus they are secreted by the foliar cell. They are secreted by a mucous neck cell, and they are responsible for coating the linings of a stomach. So they will protect from the bacteria, virus, chemicals from the outside, and damaging the layer of a stomach. Similarly, there is a bicarbonates. If whenever there is excess secretion of HCl in our stomach, they will neutralize the gastric acid and they protects the lining of our stomach. Similarly, there is enough amount of blood flow to the mucosa, so they will nourish the mucosa of a stomach. Similarly, the most important, the essential function of a prostaglandin is that they will stimulate the mucus and bicarbonate secretions. So whenever there is a decrease in prostaglandin amounts, there will be decrease in production of mucus and bicarbonate secretions. So when there is a less secretion of mucus or less secretion of bicarbonates, means there is a high chance of getting damage of a lining of a stomach. So these are defense system of our stomach and intestine. And when there is an imbalance between this mucus, bicarbonates, and blood flow or prostaglandins, they may lead to cause the ulcer. So that may leads to damage the layer of a stomach or intestine. Peptic ulcer can lead to the perforation or a GI bleeding. So this was a brief information about the defense system of a stomach. Now we'll see the causes of a peptic ulcer. So causes of a peptic ulcer is a S. pylori. Okay, so S. pylori is a bacteria that is responsible for causing the peptic ulcer. So since this is a bacteria, it should be removed by giving antibiotics. Amoxicillin is the first antibiotics, clarithromycin is the second antibiotics, and metronidazole is a third antibiotics. So 3 antibiotics are given at a time. So it's called a triple therapy. And apart from these 3 medicines, we'll prescribe some PPIs and some antacid. So this is the first agent, and this S. pylori are a bacteria that hides between the mucus and epithelial cell and may cause the peptic ulcer disease. The next is NSAID or painkiller. In layman term, we can call as a painkiller. We can find that people are taking many types of painkiller, like in market we can find Nimsulide, we can find ibuprofen, we can see a mefenamic acid. So these are all the painkiller. So whenever you are taking a painkiller, they will reduce the pain by inhibiting the prostaglandins. So whenever the number of prostaglandins is decreased, it will decrease the pain. But simultaneously, there is a other function of prostaglandins. Already we have discussed in earlier slide. The prostaglandins are help in stimulation of mucus and bicarbonate secretions, and there is lots of function of mucus and bicarbonate secretions. For example, in last slide we have seen that mucus help in it help in coating the linings of a stomach so that it protects from the bacteria, it may protect from the virus or some chemicals. Similarly, if there is excess amount of acid in our stomach, and this bicarbonate will play an important role in neutralizing those acids. So these are some important functions for prostaglandins, but because of an acid, because of painkiller, the number of prostaglandin will be decrease, and there is decrease in secretion of a mucus. Similarly, there is decrease in secretion of a bicarbonate, and it increases the chances of a peptic ulcer. So in order to protect from the peptic ulcer, we need to decrease the use of NSAIDs. Okay, so commonly in our pharmacy practice we can see that whenever the doctor is prescribing any kind of a NSAID or any kind of a painkillers, they will prescribe some PPIs, or they will prescribe some H2 blockers like ranitidine, pantoprazole, omeprazole, because of an NSAID it may cause the peptic ulcer. So with a painkiller we can find that patient is taking some kinds of PPIs or H2 receptor blockers. So the next causes for a peptic ulcer is a gastric acid. So whenever there is excess amount of a gastric acid in a stomach, it will damage the mucosa cell, and which activates the pepsin enzyme, that is a stomach enzyme. And in order to reduce the secretion of gastric acid, what we can do, we can block the H2 receptor that is present in a parietal cell by giving a H2 blocker like a ranitidine, famotidine, cimetidine. Similarly, we can block the proton pump that is present in a parietal cell by giving a PPIs like a pantoprazole, omeprazole, rabiprazole, esomeprazole, lansoprazole. So these are some drugs that can reduce the secretion of gastric acid from the parietal cell or from the stomach. So this is another way we can prevent the gastric acid secretion from the stomach, and because of excess acid it may damage the mucosal cell and cause the ulcer. Now next is that our lifestyle plays a important role for a peptic ulcer. For example, if you are smoking or if you are drinking, that will cause the increase in gastric acid secretion, and it reduces the bicarbonate secretion or productions. So because of smoking and drinking alcohol, it will increase the gastric acid secretion, which may damage the mucosal cells and reduce the bicarbonate. So when there is a less amount of bicarbonate, then it can't neutralize the excess gastric acid that is present in a stomach, and it will delay in healing the ulcer of a stomach. So to protect from the peptic ulcer, we need to stop smoking and drinking. Okay, so this was some causes of a peptic ulcer we have discussed. Number 1 is pylori, number 2 is NSAIDs or painkiller, and number 3 is excess gastric acid secretions, and number 4 is our lifestyle, that is smoking and drinking. Okay, now we'll see the difference between the gastric ulcer and duodenal ulcer. So in case of gastric ulcer, we find that food will provokes the pain. Whenever the patient has a gastric ulcer, whenever the patient is eating the food, that time they will get a pain. After having a food, the patient may get a pain. We can find that patient might be having a gastric ulcer, but in duodenal ulcer we will not see that kind of things. In empty stomach we will get a pain in a case of a duodenal ulcer. So if after having a food it may provokes the pain, but when we'll give a H2 blockers like a ranitidine, or if we'll give some PPIs, that will relieve the pain. Okay. Number 3 is that in case of a gastric ulcer, we'll find the weight of a patient is decreased. There is a weight loss, but in duodenal ulcer there is no any changes in the weight. So next thing is that since the ulcer is in stomach, if there is a severe type of gastric ulcer, we can see the blood in vomiting. So in case of a duodenal ulcer, so we can see here the empty stomach provokes the pain, and eating food might relieve the pain, and there is no changes in weight. Weight is normal in case of a duodenal ulcer, and we can find the bloody stool. because this is in duodenum part in small intestine. So that blood will mix with the stool, and we can see the stool color is in dark in color. Okay, so this was a important difference between the gastric and duodenal ulcer. Now we'll see the diagnosis part. So number one is a biopsy. So if we want to diagnose the causative agent to detect whether the peptic ulcer is caused by a S. pylori or not, we will do a biopsy. So number two is endoscopy. We can do endoscopy to detect any kinds of erosions or ulceration or perforation in the small intestine or in the stomach. So this endoscopy will also help in detecting the types of peptic ulcer. Number three is a urea breath test. So urea breath test means we'll give one tablet that consists of a urea. So whenever the patient is taking a urea tablet, so if in his stomach there is a S. pylori, the S. pylori will secretes an enzyme known as a urease. So in presence of urease, this urea is break down into a carbon dioxide and a ammonia. So if we'll find the amount of carbon dioxide is more in blood, we can find that patient might have a peptic ulcer. So this is how we can use a urea breath test to detect a peptic ulcer. Okay, I think you are clear with these slides. Okay guys, this was all about a peptic ulcer. So we have discussed almost everything about a peptic ulcer, about a treatment part, about a diagnosis part, how we can reduce the SCL secretion from the Paral cell, process of digestion, and part of the stomach, different layer of the stomach. Everything we have discussed about a peptic ulcer. If you find this video are useful for you people, you can share with your friend, and please don't forget to subscribe this channel.